I think every specialty is different. The extent to which telehealth can be used as a percentage of all visits varies pretty wildly. As you move forward, do you see telehealth playing an important role beyond COVID, when someday we don't really have to think about it as much, hopefully?
Yeah, I mean, it's nice to, be in the convenience of, your office or your, home or, whatever to do have some of those follow-ups. And I think, even doing a few, like 2 or 3, back, like if you need some of those appointments, I think it's fine. I think after a while though, it is important to have that touch base. So now that people are getting more comfortable coming in, the way we're handling is, we'll have a few telehealths and then we'll have an in-person and in-office follow-up. And
Yep.
then, a few more telehealth and then an in-office, because it's just helpful to see how has the pain improved, or if there is a difference, where is that going? So it's still
Yeah.
important to have that face-to-face, to have that more that examination. So we're kind of doing it a little bit like twofold.
Yeah. So you've got this hybrid kind of setup, and how do you
Yeah.
feel that? Do you feel that people appreciate the convenience and still get the value out of the telehealth visit as they would have otherwise coming in?
Yeah, I mean, the doctor still spends as much time as he would if he was, walking into the room and talking to them.
Yeah.
This he's just on the phone, and he's kind of asking his questions. And if something does seem a little bit like unsure and he's not able to gauge, then he would ask, let's do a follow up in person. If you can come later this week or the next week or something. If something isn't, they're having a hard time understanding. But for the most part, the way that they've been going, it's been going really well, and it's
That's
been
great.
helpful for, I think, both sides, for us to also continue to manage a limited number of people in office, to make sure we're still making sure that we have the social distancing measurements in place,
Yeah.
but yet being able to help a bigger number of people as well.